Previously on Chicago Hope.
The flight of the heart, a NASA flight devoted to cardiovascular experiments.
You know that awful cardiology jerk you're going to have to nominate to do your experiments in space? Could it be me?
NASA's agreed to consider you for one of their candidate spots.
I don't know how to thank you, Gordon. Thank you.
I was one of the leading neurosurgeons in the country.
I thought you were a psychiatrist these days.
Well, why can't I do both? I'm good at this. I'm really, really good at it.
I'm not interested in training competent psychiatrists. I want you to use your talent.
We have a baby girl. It's so beautiful.
Yeah, she is.
Just wish you could stay like this forever.
You're gonna be a great dad.
Oh, I guess I just thought you might want to stay home.
Why, you want to stay home?
Diane?
Can't you sit home for a year lactating?
I'll stay home with her. Right now, she's the most important thing to me.
Or you think she's not important to me?
And we can't start without Diane. There are items on the agenda which directly affect her.
Well, it's not like her to be late. Should we page her?
Did I really? Can we at least talk about this baby-friendly nonsense?
What nonsense? There's a contract stating that the hospital feels breastfeeding is best for the child.
Forcing women to nurse? It's a little Orwellian.
They're not forced. They're encouraged.
But we're not allowed to send them home with formula. That seems like pretty heavy encouragement.
Are you challenging the obvious health benefits of breastfeeding?
I'm not challenging anything.
Where's the contract for the dad to sign stating he won't beat the crap out of the kid?
Philip, I think your meeting has begun.
Can I just make a quick announcement? My recent involvement with NASA has, kind of sparked my interest in the space program. Anyway, I'll be training as a candidate to replace Gordon Mays on the Flight of the Heart mission, and hopefully I'll be conducting cardiology experiments in space. Oh, and Philip, by the way, I am confident that my training will not in any way interfere with my surgery schedule.
Someone please page Diane again.
Did you try the swing? She likes the swing. I think it's just a little fever, Billy. 99 degrees is normal for a baby. Well, maybe if you let her hear my voice. Hi, sweetie. It's Mommy. Down in the meadow in the itty-bitty pool swam 3 little fishies and the mommy fishy too. Swim, said the mommy fishy, swim if you can. And they swam, swam, swam right over the dam. Boop, bop, din, dad, and wah, don't you?
Okay, I'm going to admit the patient in 2 possible cholecystitis. I'm going to need to book an ultrasound this afternoon, and we got prostatitis in 3. Keith, I don't think you've officially met our new surgical fellow, Dr. Robert Yates, Dr. Keith Wilkes.
Yeah, we met briefly.
Yes. There's Dr. Yates, is our first-round draft choice, Harvard Medical School, and did a surgical residency.
Dr. Waters has been singing your praises, Dr. Wilkes.
Really? So how did Philip hook you into coming here?
Oh, he was very persuasive. And I think this is where I'll experience the most growth. Plus, the pizza is very good here. In Chicago.
I'd like him to start working the ER with you. I'm trying to give him a chance to get a lay of the land. Can I talk to you for just a second?
Of course.
Excuse us, please. Philip, I don't know if today is going to be the best day for this. The ER is really busy, and I'm under a lot of stress. Can't you give him to somebody else? Well, he's the only one available, but what is this really about? Okay, I'm going to be honest with you. The guy makes me uncomfortable. Oh? Yeah, I mean, he's weird. I mean, look at him. What is he doing right now? He likes flowers. He came here for the pizza. He was joking. Philip, don't do this to me. I'm sorry, it's a done deal. Beautiful. You're in very good hands, Dr. Yates. We'll talk later. Thanks. So, you ready for an enlarged prostate?
Well, I'm a little young for that, I hope.
I mean the patient.
It's humor.
Great.
Take her for a walk. Oh, maybe she needs fresh air. It's not that cold, Billy. Wrap her up. She's a baby, not an orchid. She's not going to die from exposure. Oh, thank God. I'll call you back. What is wrong with your gender?
I have no idea.
I hate to insert myself into the equation, but my ankle hurts like hell. Oh, we're waiting on the x-rays.
How'd you do this, Mrs. Kaysen?
Oh, it's a guilt injury. Trying to keep my son happy by rollerblading with him. I just had another baby, and he's feeling neglected, so...
And, of course, your husband isn't much help, right? I mean, he says he wants to help, but he leaves all the decision-making up to you.
Actually, I don't have a husband.
Oh. You can take it from here?
Not a problem.
I've always been a little scattered. I blame it on the artist mentality. When did you actually start losing time? Started to notice sculptures that I didn't remember making. They'd just appear. That was about 6 months ago. It's escalated from there.
She'd call me from places all over town. Not sure how she'd gotten there. No way to get home.
Do you use drugs or alcohol? In college, I was pretty experimental, but nothing major.
Other than the waking blackouts, what have you experienced?
Dizziness, loss of hearing, blurred vision. Sometimes my vision actually goes away momentarily. Blindness. Yeah.
She can't judge distances. Bumps into furniture. Show them your legs.
And this was a good week.
Veneers would explain hearing loss, but not the depth perception. Transient ischemic attack would take care of the blindness and the DP, but not the hearing. The dizziness sounds more like MS.
Now, what about the blackouts?
My money's on the talk screen.
You think she's lying?
Well, I don't know, but she has so many symptoms, she needs a battery of tests. It's going to be difficult to find. But I thought we'd start off with an MRI, and then if that yields nothing, we'd go for an angio.
Angio? Don't you think you're jumping the gun a little?
Yeah, and her symptoms are very serious. I mean, people come to our department when something is acutely wrong. We don't wait and see. Psychiatry, that's slow, not neurosurgery.
Well, I'll try to remember that.
Mr. Hardy, I'm Dr. Wilkes. This is Dr. Yates. What seems to be the problem?
I've been lousy for a long time. I'm a student at Northwestern. I missed 2 weeks of classes. Really gotta get better soon.
What are you studying?
Art history.
Really? Did you know that Ruskin was terrorized by his wife's pubic hair on his wedding night and never consummated the marriage? It's true.
You do have a slight fever. Mildly dehydrated. Let's see, body aches, stomach cramps. You probably have the flu.
It's gotta be more than that.
Well, sometimes these things can drag on. I'm going to give you something for the nausea, and I want you to keep taking aspirin for the fever, all right?
What about this rash?
I don't see a rash.
I do.
There's no rash.
There's a rash.
Can we speak?
Excuse us.
What are you doing?
The kid has a rash. We should admit him to a full blood workup.
He has the flu. I'm not going to admit it.
Something tells me his immune system's been compromised. I'd like to know why.
Something tells you?
My intuition is pretty reliable.
Well, so is my use of science.
I once diagnosed a high-grade glioblastoma in a 30-year-old woman which was being treated as a sinus infection. I did this by placing one hand on her forehead and the other on the base of her skull. It's documented. You can look it up. But ultimately, it is your call.
Okay, but you're taking responsibility for this.
Done deal.
We lost the pulse on the ride. Already gave him 2 rounds of epi.
How old is he?
6 weeks. Was it premature? No, full term.
This baby's severely dehydrated. Let's give him volume.
You have to save our baby.
Doing everything we can. Diane?
Let's go.
How much does he weigh?
I don't know.
About 7 pounds.
At 6 weeks? He's small. He's always been small.
What was his birth weight?
6, 12.
Has he been sick? Any diarrhea?
No.
Let's give him 0.35, 1 to 1,000 FEIV. Balance. Charge to 6. Right. 6. Clear. Nothing. Charge it again. Charge to 8.
Keith.
Don't have your choice. Clear. Charge again. Clear. Time of death, 2:35.
What the hell did you do to this baby?
What?
Keith, it's obvious. He's 6 weeks old. Look at him.
We won't know anything until we have the autopsy.
An autopsy, a first-year med student could figure this one out. This baby's been starved.
Maybe she wasn't producing enough milk. Some women don't.
Then she should have paid attention to that. The baby was skin and bones.
Dr. Grad, what do you want us to do?
Arrest her.
Arrest her for what?
Criminal negligence.
I did not neglect him. I was concerned, and the nursing director told me I shouldn't supplement.
Could we let the Rosses go home? I think they've been through enough for today.
I think that'd be a good idea.
Wait a minute, you're just gonna let them walk right out of here?
Come on, Diane. Come on, let's go. I'm not going to do anything without an autopsy.
Keith, you saw that baby. You saw how small that baby was. Come on.
I agree, Diane. He could have been malnourished, but he could have also had a heart defect, gastrointestinal problems, any number of things. Let's wait until we get the autopsy report. Could you make sure that they get a ride home?
Keith,
Sorry if you think I'm jumping the gun here, but it's pretty obvious.
We're not in a position to make that call, and I'm pretty sure that this is still my ER. I'd appreciate it if you'd remember that.
What have we got?
Ellen Galloway's test results. MRI is normal, so is the EEG.
Maybe she's faking her symptoms. Did you consider giving an eye and auditory exam?
Gave her a series of those. Some showed substantial vision loss, some didn't. There were also fluctuations in a hearing test.
Weird. Next up is the carotid Doppler, and after that, angio.
Well, that's a little invasive when we haven't even considered a psychological angle.
So, you have a psychiatric analysis of this?
I'm considering one. Dissociative identity disorder.
Multiple personality?
Well, it's not called that anymore.
But still, you mean she has more than one personality?
I mean, she may have a severely compartmentalized personality. This disorder is real. It's been documented.
Oh, UFOs have been documented. I'm sorry, Aaron, it just sounds so far-fetched.
I'll show you the research, if you're interested. Unless you're more comfortable dismissing scientific findings out of hand.
Oh, hey, excuse me. This is my patient.
Not if it's redefined as a psych case.
Well, according to the preliminary autopsy, the Rothschild died of heart failure, secondary to dehydration, which would seem to indicate starvation.
Not to mention the rib cage showing through his skin. And according to your report, there were no other health problems.
Not at all. He was born perfectly healthy.
And you concur, Dr. Wilkes?
Yes, I do.
As counsel for the Rosses, it's my job to represent their point of view. According to Mrs. Ross, she was simply complying with the rules given to her by this hospital.
What rules?
The baby-friendly contract that she signed.
She signed a contract saying she'd let her baby starve?
No, Dr. Grad, she signed a contract saying she'd do everything in her power to breastfeed her child.
That's not what the contract says. What the contract says, the hospital feels the breast milk is the best nutrition for an infant.
Whatever it says, common sense would have told her.
Sleep-deprived new mothers don't always rely on common sense, Dr. Grad. They rely on medical advice.
Look, spare me. The fact is, a baby is dead, and there is no excuse for it. If they were relying on any kind of medical advice at all, this would never have happened.
Dr. Grad, please sit down.
What, Philip? I'm not wrong about this.
In any case, the report has been filed. And as state's attorney assigned to this case, I'll review the facts and I'll decide whether it's worth prosecuting. It's not up to the doctors anymore.
I'm aware of how it works, Ms. James, but the language in the medical report has a great deal of influence in terms of whether or not you choose to prosecute. Am I right?
The medical details are crucial, yes.
Or the big scary words bother you, like severe edema from prolonged malnourishment?
Diane, please.
There's always more than one way to interpret an event. Because your hospital put pressure on my client to breastfeed, she ignored her instincts.
Please, what do you know about instincts?
You are a mother, aren't you?
You bet I am.
And yet you work, leaving your baby for hours every day. Is that what your instincts tell you to do?
Go to hell.
Mrs. Galloway, the good news is the MRI shows there's nothing wrong with you, but that's also the bad news because it means we have to do some more tests.
How long will that take?
Another day or two. Now, about your diabetes, are you on insulin for that?
What diabetes?
Well, your blood test revealed that you were diabetic, but I assumed you knew.
I'm not diabetic. I had a physical last month for insurance. They tested for that.
Oh, well, we can certainly run the test again.
Please do.
Do you mind if I ask you a few questions?
I don't mind, but I need to tell you I feel a little awkward since I have no idea who you are.
I'm Dr. Shutt. I'm one of the doctors who admitted you.
I don't know that.
Why do you think you're in here?
I assume there's something wrong with me.
But you don't remember meeting with me or Dr. Guitar. Does that bother you?
Well, sure. Wouldn't it bother you?
There's your dying patient. AIDS, negative. Leukemia, negative. Diabetes, lupus, MS, Hodgkin's, lymphoma, even scleroderma, negative. And he's not pregnant either.
Interesting.
Are you satisfied?
Not yet. We need to do more extensive tests. I'd suggest a serum electrophoresis and a full Epstein bar titer.
There is nothing wrong with this man. He's in better health than I am.
It's not consistent. It doesn't scan.
It totally scans. I'm going to release him.
I need to think on this, if you'll excuse me.
You can't just walk away. This ER is full.
This is part of my process in treating a patient. I just need to create a little space.
I'd like to create a little space between your neck and your head.
She's 6 months.
Oh, sorry. That's so hard to tell at that age.
Yeah, well, waiting for the hair. How old is she?
She's 5 months. Such a cute age.
Yeah, it is.
You live in our building, don't you? I've seen you around.
Right, that's why you're from there.
I see your husband a lot at the park.
Yeah, he's a stay-at-home dad.
Oh, that's great. You are so brave to go back to work. I could never do that.
Oh, yeah, it's hard, but you get used to it.
Oh, I just miss that time with her. It goes so fast.
Honey. She needs a good nap. It's breast milk.
Of course. We should get them together for a play date sometime, or maybe I should talk to your husband about that.
Yeah, I guess so.
It's nice talking to you.
Oh, Diane.
I'm Sandra. I'll see you later.
Okay. What is it? What is it, Emily? What do you want? What do you want, honey? What do you want? Here, look. Okay, see? You hungry? Dissociative identity disorder. That's a good one.
You ever see it before?
The Jerry Springer show.
So you don't believe it exists?
No, it's in the DSM. The medical community doesn't deny it exists. Just that, while it can happen, it almost never does. I, on the other hand, am of the opinion that we've grossly underestimated the true rate of occurrence.
Because of the Jerry Springer show?
No, because of history. A century ago, nobody diagnosed schizophrenia or bipolar disorder, panic disorder. Even before there was a name for it, people who suffered from this were just considered insane. I've seen studies that report 200,000 cases of dissociative identity disorder in North America.
Well, that's pretty stunning. I thought I was going out on a limb.
You are. It's an uphill battle legitimizing a new diagnosis. This isn't an ego thing for you, is it? I mean, you are a neurosurgeon.
Well, there's a valid basis for the diagnosis. I actually think this woman can be helped.
Good. I'm willing to trust your instinct if you are.
Okay. Where do I go from here?
Well, it's tricky. You can't tell a patient she's DID. Not unless she's already open to the idea.
How do I know if she's open?
You can't plant the idea, but it's dangerous to let it go undiagnosed, especially if there's a self-destructive alter.
You're saying I have to figure it out?
You give the case to someone else.
That's not my style.
Good. Hey. Sorry I'm late, Philip. Hey, Joe. Didn't expect to see you here.
Well, here I am. Have a seat, Kate.
Okay.
I'll get right to the point. I'm removing you as chief of surgery. I'm handing the position over to Dr. Kakachi.
No, really.
Really?
But, Philip, that's laughable.
And the last laugh goes to me.
But you can't be serious. I mean, why would you do this to me?
Why would you suddenly decide to join the space program and announce it glibly in a staff meeting, never considering that I might have some objections?
Ah, I see. You're punishing me.
No, I'm making a reasoned decision. There's no way you can do your work, given the strict requirements of your training program.
But I told you it wouldn't interfere with my schedule. I can do this, Philip.
That's wishful thinking, Kat.
In the future, I'd like major decisions, like yours, explained to me in private.
Okay, fair enough, Philip. But even if you are taking this position away from me, do you have to give it to him?
Joe's a fine doctor.
But he's not a leader. I mean, people don't respect him. No offense.
Sticks and stones, Kate.
But he's just such a...
Decision made.
I want to hear it.
amphibian.
Let's call a toad a toad. I'm prepared for conflict.
So, he's the boss. That's impossible. She's too young. No. No, all the way over to the TV? Really? Do you realize how advanced this is? Just a second, Philip.
Now.
The Rosses are suing us. What the hell are their grievances?
Malpractice.
We did everything we could for that baby.
They say the hospital policy caused them to use bad judgment. The baby-friendly contract caused Mrs. Ross to resist supplementing with formula. In fact, our lactation consultant explicitly told her not to supplement.
Even though the baby was starving.
Well, the consultant claims Mrs. Ross didn't indicate the child's severe lack of weight gain. She told Mrs. Ross to take the baby to the doctor.
And she didn't?
No, she had an appointment, never made it.
Oh, this is just ridiculous, Philip.
And so, one more thing. I'm suing you for harassment and emotional damages.
What?
Keith said you were pretty relentless.
I took a stand. I'm a doctor. I'm supposed to do that.
Yeah, and you have to keep in mind the parents' grief.
Well, what about the baby? Who kept him in mind?
Are you sure you're all right with this transition of yours? Maybe you've taken on too much.
Am I not doing my job?
That's not what I'm saying.
But it's what you think.
Gates, where the hell have you been? I've been looking for you for an hour. Didn't you get my page?
I turn my pager off when I meditate.
You are on call. You do not turn off your pager.
I know it might strike you as a little bit odd, but unless I take a few minutes and let go of all the noise, I'm no good to anyone.
Here's what strikes me as odd. I just found out that you readmitted Peter Hardy after I released him.
He wanted to stay.
Yeah, because you convinced him he had some kind of terrible illness.
Dr. Wilkes, has it ever occurred to you that a person who has lived inside his own body for that many years might have a valid sense of when his system is broken down?
you're a zagnut. You know, you're 12 different kinds of crazy. How the hell did you ever make it out of medical school?
Now, how do you make it out of bed in the morning, Dr. Wilkes, with all that anger and fear inside you?
Hey, I'm the physician in charge here. You do not get to comment on my behavior.
You're right. You're right. I got into your energy for a minute, and it's ugly in there.
I'm going to go finish up in the ER. Then I'd like for you to meet me in Peter Hardy's room, where you will explain to him that he simply has the flu and that you're some kind of undiagnosed, high-functioning schizophrenic.
Aaron, I have to tell you, this is the last thing the hospital needs. We're already in the process of being sued. Now, diagnosing multiple personalities could land us on 60 minutes.
Dr. Weber supports me on this.
Dr. Weber is not the last word.
Please tell me you haven't approached the Galloways on this matter.
No, but I want to.
Aaron, you are flying by the seat of your pants. You are speculating on this woman's life.
Lisa, I understand your hesitation. There was a time when I couldn't see past the chemistry and the neurological impulses.
Oh, so you've surpassed me.
Where's your diagnosis?
I'm ready to do an angiogram.
Why put that woman through an invasive procedure when there is hard evidence that her problem may be psychological?
What evidence?
Everything. The fluctuation in her test results, her loss of time. 1 minute her blood test is negative for diabetes, the next it's positive. There are documented cases of DID patients changing their metabolic makeup based on which altar they're in.
Medically speaking, multiple personality is about as reliable as the vapors.
Aaron, data notwithstanding, this woman came to you as a neuro patient. Now, it's inappropriate to psychoanalyze her.
I'm supposed to ignore my training.
You know I've been at odds with you over whether or not you can function in both areas. This is a perfect example of how it breaks down.
Now, this is a perfect example of how different areas of medicine refuse to cooperate with each other. Now, maybe I am spreading myself thin on this, but just maybe I've got a clearer vision than either one of you.
Hey, Diane, do me a favor.
I'm too tired for favors, Jack.
Remember Miss Kaysen, nursing mother with a broken ankle?
Yeah.
She needs surgery. Without it, her ankle's going to heal in 9 different ways. All of them are rendering her a virtual cripple.
So operate.
No, she refuses because she'd have to stop nursing.
Why?
Why? Because she'd be in the hospital for 3 days and she'd need to be on pain meds. You're a lactating mother. Explain to her that her child won't suffer irreparable damage if she stops nursing.